Hello and welcome to Business Insider with Mario Toneguzzi on YYC Business. Joining me today is Paula Allen, Global Leader and Senior Vice President for Research and Total Wellbeing for LifeWorks. Thanks for joining us today, Paula.
Pleasure, Mario. Always good to speak with you.
Well, you folks put out your May Mental Health Index, a monthly indication of kind of the state of mental health in Canada. It was negative again for the 14th straight month. And it also, which I found interesting, reversing a trend of steady inclines for the last couple of months. So why is that happening?
Well, it's certainly something that we have to watch, but watch very carefully. We will. What we and it goes along with some of the things that we've been seeing anecdotally. So even though there's a lot more optimism right now, we're in a great place and moving forward with vaccines. We're starting to reopen, see cases go down in many areas of the country. We are going through another period of change. We're starting to talk about what things will look like back in the office if you are working from home, where some people are still not so comfortable, even with the changes that are happening in terms of our public health risk, about going immediately back into congregate settings. So remember that people don't like change. The human mind doesn't like change. And even though this change is, on the surface, very, very positive, it's still a change which is stressful. So we do have to be careful.
Yeah. And one of the most disturbing things about this report this time around is the increase in alcohol and drugs usage by people. I guess not surprising. What do you think? It's not surprising that you would see in stressful times like these an increase in those areas?
Yeah, very unfortunately, it isn't. There are a few surprising things, but people, when they're going through a fair bit of stress, cope in all sorts of ways, and some of the ways are less healthy than others. And use of substance is an increased use of substance is one of the unhealthy coping strategies that we know that people use. So, the fact that there's an increase isn't that surprising. But we also are seeing some really significant increases in a couple of groups. So post-secondary students. So not a great situation at all for that group who's been really very negatively impacted, and at a stage of life where you really don't want to go down a path that's going to impact you for the rest of your life. And parents. So that was one of the things that was the most interesting. We have seen the mental health of parents be more compromised throughout this pandemic for so many reasons. But the fact that they're also much more likely to have increased drug and alcohol use, and that it is impairing them. They are saying it's impacting their family responsibilities. That's a real concern.
Let's talk about each of those two groups for a second here. First of all, students, post-secondary students especially. Why is it stressful for them right now?
Well, it's a stressful period of time in life, generally speaking. You're going through change, you have a lot of uncertainty, you have a lot of hope and aspiration, but there's a lot of uncertainty about your future. You're transitioning from the family home into, independent living in certain situations. So many things are going on that are really quite stressful. So we know that it's a vulnerable time.
Yeah.
And during that time, what's really important is to have that solid social support, the support of your peers going through this structure to help you understand and feel a little bit more secure when a lot of things are not very secure. And very unfortunately, the pandemic took away both.
Yeah.
So, they didn't have the social support that they did before. The structure in terms of classes, everything was very different in terms of the school experience. Plus, financially, this is the group that was the most impacted, because when you think of, the industries that literally shut down, retail, food services, accommodation, and where do students find jobs in those industries?
Yeah. What about parents? Why has it been particularly stressful for them?
Yeah, well, being a parent is wonderful in so many ways. I mean, it does actually, I'm a parent myself, it does double your joy, seeing the joy of your child doubles your own joy. But it doubles the potential for feeling vulnerable as well. So if your child is not doing well, if your child, has disruption in their lives and routines, you're not only having to deal with it for yourself, you are literally doubling and sometimes tripling your concern because you're having to manage a situation that's potentially chaotic for another human being. And what we looked at is that the number one concern of parents is actually not, the school situation and the lack of outlets for their children. Those are concerns, but it is the mental health of their children. And we have seen mental health concerns amongst children skyrocket, doubling emergency room visits for children,
Wow.
astronomical increases in terms of eating disorders. Children have had a very difficult time through this pandemic, and their parents are having a difficult time as a result.
Okay. The last question for you, Paula. I know you don't have a crystal ball, obviously, but as we look forward into the next mental health index, do you think there might be a little bit of an improvement simply because the country is opening up again? For example, here in Alberta, as of July 1st, all restrictions are gone. But and there's also the vaccinations, are soaring in the sense that there's a lot of people getting vaccinated. So do you think that index might show some improvement going forward?
Well, I wouldn't hazard to predict what next month will be like, but I do believe that overall we are going to see a positive trajectory. I do think that, even with the change that we're undergoing, we are getting a sense of control back, which
Yeah.
is so important to our mental health. So I do see it increasing. But I do think that we have to be realistic. It's not going to shoot back up. It's not. We've been going through this for such a long time, and research on past pandemics, SARS and other exceptional epidemics in the world have shown that the impact of this time can last 3 years or more on the mental health of a population. So we do have to really be careful in terms of just expecting things to snap back and therefore not really paying attention to our mental health, because we're going to take a little while to get back to even where we were before. And I would hope that we would get back better than where we were before eventually.
Okay, great. Thanks for joining us today, Paula.
Pleasure.
Okay, that was Paula Allen, who is Global Leader and Senior Vice President of Research and Total Wellbeing for LifeWorks. This has been Business Insider with Mario Toneguzzi on YYC Business. Thanks for joining us today.